The United Nations Population Fund, in collaboration with the Cross River State government, is currently offering free repairs for patients suffering from vesical vaginal fistula right here at the General Hospital, Calabar, Cross River State, Nigeria. I am Brian Henshaw and I'm with Unical 103.5 FM. Come with me as I have amazing conversations with some of the patients and maybe surgeons as they tell us their experiences from pre-surgery to post-surgery procedures. Let's go. And I'm being joined by Mrs. Awisa, who is, a matron here in the nursing department of General Hospital. Very good afternoon, ma.
Afternoon.
How are you feeling?
I'm good, thank you.
How's the experience been dealing with patients with vesical vaginal fistula?
Okay. Obstetric Fistula Centre is a special NGO center.
Okay.
Designated here in General Hospital, Calabar. It was established in June 2012.
Okay.
With a doctor and 2 nurses that were trained.
Okay.
That started off this place. So, and in this center we carry out activities like pool effort, which currently now is going on.
Okay.
And routine repair also.
Okay.
So we have those 2 types of repair.
Okay. These
are the patients that leaks urine. Some of them leak feces. And if you look at the characteristics of our patients, see that there are people that are like somehow abandoned.
Okay.
And you see them withdrawn because of their condition. In fact, you see them, disassociating themselves from the social gatherings like that because of the stigma. They can't move freely because of their condition. And so this UNFPA are the founder of this this initiative with the spotlight. And then they look into the problem of these persons, and then they get themselves involved. And then from time to time, see how they sent in fund for these people to be taken care of. And so we do go out for mobilization exercise to rural areas like that, mobilize the patient, and then get them down here for repair. Especially during pool effort like this, where we have them in number. But apart from this, the place is the treatment here, we offer free treatment. So whether pool effort or routine, all is free and they still access the same treatment.
Where did you come from for this surgical procedure?
I came from Abuja.
From Abuja. So tell us, how has the experience been?
It's very okay. At least they made us very comfortable.
So how did you learn about vesical vaginal fistula?
Well, I got the news through media.
Okay.
WhatsApp. So I saw the post. I was like, okay, let me just. I was not sure. At first I thought it was a scam, so I decided to give it a try. And when I came, it was very okay. And they made us very comfortable. Based on the feeling there is okay, balanced diet. And they provided everything we need. And they never treated us bad. They are friendly. So they made us feel as if we are at home.
Okay.
As if we leaving your comfort zone to a strange place, we did not feel such. So they made us very comfortable.
Okay. So, what do you have to say to people that don't know about this fistula disease?
Well,
or condition,
what I have to say is, people that don't know about it, I guess, though through the means how I got the information, I would prefer, because it's not everybody that has Android phone. So what I would love them to do, they can just go through radio, because I know even the poor can
Access radio.
access radio.
Okay.
So I prefer the developer go through radio, keep doing the announcement
Okay.
that those in the poor villages be able to get information and come to fix themselves.
All right. Thank you so much. All right. Thank you so much. We wish you speedy recovery. Okay.
Thank you very much.
From the look of things, you've already gone through the surgical procedure. Tell us, what has the experience been like?
Well, it has been a nice one because the staff I met, before you are taken to the theater, you are very comfortable.
Okay.
So before entering the theater, though I was tense because I've not had this before.
Okay.
So a word of encouragement just to suit my ears. With what they told me, not being by our side.
Yeah.
Even while the operation was going on, the doctors were wonderful. So I did not have any kind of complication.
Okay.
So it was really good. I had this problem right from when I had my first child,
Okay.
who is now 19.
Okay.
So, when things like that happen, there's no how you be comfortable. And I try to manage it.
Okay.
So most of the people around me, apart from my core family members,
Okay.
nobody will know about my
Okay. Okay. So, from what I've gathered, it's a free service, right? The United Nations Population Fund paid for this service. So, what do you have to say to them?
I'm really grateful. Even when they visited about 2%, I just found the people, they're just wonderful. So God will bless them. So much thank you for coming into this, or bringing up a program like this to make people, women, to help women out of their problem. Because looking at this service, if you want to go to a private clinic to access it, I don't think many women will have financial capability to do it.
Yes.
So thank God so much for that. They really tried for me. Some those in the villages that have less financial capability, yes, they can come and have these services and they be treated. It has been a very wonderful program.
Okay, so what are your last words to women like you who are out there and suffering from the fistula condition? What do you have to say to them?
Encourage them to come because most of them are doubting the program.
Okay.
Even when you tell them it's free, Nigeria had people, some will doubt.
Yes.
It cannot be free. It's only when they will tell you, when somebody discouraged me now, they will tell you it's free. When you get there, there's no how you will not. So when they come here, I have seen that
It's completely free.
very free. Even the food they give to us, despite the society, I just watch some women and at least to come and give it a try. Yes.
All right. Thank you so much. I wish you speedy recovery. Right? Thank you. We just came up from the theater. What was the experience like?
Well, it's usual experience and full with excitement and emotions and passion. That's fistula surgery for you. And one most important thing is that no one fistula surgery is the same. Even though the diagnosis may be the same, but there are a lot of variants.
Okay.
So that's what we see. So it requires a lot of innovative, and that's why one specialty can handle it.
Okay.
Even if you're a gynecologist, as a professor that is a professor of gynecology.
Okay.
Even if you're a general surgeon, if you're a plastic surgeon, whatever aspect of surgery, you need to still go in for the training as a fistula surgeon, because that cuts across every area.
So how long have you been a fistula surgeon?
We graduated 2015.
Okay.
So since then, we've been building up hands-on, moving from one state to the other. We went to Maiduguri, back to Fort and to other places, and that keeps your skill. As I've said, no single fistula surgery is same. So the more you put your hand on, even till now, I'm still learning. So everybody learns every day. So the more you become more skillful.
Amazing.
So since 2015, I've been on it. But it was not until 2018 that I was certified to be on my own.
Okay.
Between 2015, we opened the center 2016.
Okay.
Between that 2016 and 2018, we used to do what we call pool effort, which is what we do now.
Yeah.
So the pool effort will bring surgeons from other part of the country.
Okay.
They will come in and operate with you. They leave you to care for the patients, and then until the patient is rehabilitated and reintegrated. But after 2 years of moving around with them, they saw my hands strong enough, and then they declared the center apart from being pool effort center to be a routine care center. In other words, after what you are doing or leftover, and those who had issues, they can come in anytime, get operated like any other surgery and walk away. You don't wait to gather them into a group. So it's now both a pool effort center and a routine center.
Okay, that's nice. So what has been the challenges you have faced as a fistula surgeon and this unit as a whole?
As a fistula surgeon, the first challenge is most of my colleagues don't really have that will to subject themselves to this passion.
Okay.
So the major challenge is that I'm working like basically alone, and that's not too good for me because stress of work and all that. I see nurses more having passion to the work than doctors. So that's one major challenge. The other challenge in terms of sources of materials, consumables, UNFPA has been supporting the center. They've been doing a lot. They actually supported the training. So it's UNFPA that is collaborating across the state government to do what is happening. So for consumable materials, the challenge is quite little or no challenge at all, because they always made that available. And then the other thing usually used to be light, you know, but they gave us a backup of solar.
Okay.
Our solar had a little issue, the batteries have run down, and they came up for that to give us a 6 kVA generator, which we are still installing, but at the moment the hospital is supporting. That's the government side. You know that we cannot really do without my own government. So my government is also doing a lot to support us in terms of providing alternative power source, which is the hospital generator. But now that we have our own, and we could be more autonomous than what we used to be. Then we also look at the patient conducive environment in terms of what they normally call what the nurses call, there's a language called kind of pulling the patient pains away by making environment more conducive for them. That is on ground. They've just seen DSTV, and if you had been here Those of you came to. Some people were. Oh, it didn't come.
No, I didn't.
You were to come, but during the World Fistula, they came.
Okay.
If you had come that time, you would have seen that flat screen wasn't there. The Go TV was not there. That was installed, I think, 3 days ago.
Okay.
And that makes our patients that have come this time to be more psychologically embraced to accept the surgery, accept the environment. Things pull the attention away from the pain, from the agony that they've been for years. So that's kind of holistic care we are looking at. The psychological aspect of the patient is being taken care of.
Amazing. Okay, so what are your last words to women who live with fistula, obstetric fistula, but they're not willing to come out to receive treatment?
Well, it's very simple. Obstetric fistula has become a huge public health burden, and the federal government has taken a very bold step in the sense that is coming in to take up much of the responsibilities of UNFPA. As I'm talking to you now, obstetric fistula has been pushed under the National Health Insurance Authority.
Okay.
So it's going to be like fee for service. So you operate, they've sent the money for consumable feeding and everything through the hospital, and that caters holistically for the patient. So I want to use this medium to dismiss their myths and all the misconceptions that they have to believe that it is their mother-in-law or a friend who did not like you that is making you to give birth, and then the urine cannot stop. And secondly, I need to tell them that part of the problem of fistula is much of a preventive section.
Okay.
So if we access the facility where there is a doctor, there is a trained midwife, that have the competence to care, has a limit, knows when and when to refer a patient, when labor should stop, or when you should stop pushing a patient through labor, you should decide when to do surgery and so on. Fistula may not be as rampant as it is, even though you may not completely rule it out because some of them surgery can also cause it. And so we want to tell them to stop apportioning blame to witchcraft to all other forms of stories, and know that it is curative. They just need the surgery and they get themselves dry. So they should come out. Here they get their transport. Here they have free feeding. Here they don't buy anything. Consumables for the surgery is free. They're not paying any surgery fee. Bed is free for the 14 to 21 days that they are lying here.
Okay.
So it's totally free. So that's my advice. Let them come out. Because the vision of the UN is we want to put an end to fistula in 2030.
All right. Thank you so much, Dr. Ayi. Thank you very much.
You.
All right.